Hi everybody. I'm just going to talk about dry eye tonight. I know many of you probably suffer from that too. I've been suffering from dry eye for the past 7 or 8 years or so. It first was diagnosed in 2008, and while I was leading up to all the things that happened with my type 1 diabetes diagnosis, and I used, it started out as an infection, which seemed to be conjunctivitis, and I had various treatments for that. Tried various crazy things like baby shampoo to wash my eyelids. Don't do that, because that made me about 50 million times worse. And eventually I went to a doctor in New York City, and he diagnosed it as ocular rosacea. Now, as I said, at that time my type 1 diabetes was coming out, and I would get symptoms like my eyes, when I would eat certain foods like tomatoes or acidic foods, my eyes would puff up within like 20 minutes. Like I would eat pizza, my eyes would puff up and become more inflamed and red. My bladder would be more irritated. My whole body was like reacting. It was just crazy. So eventually I went to a doctor, and he diagnosed it as ocular rosacea, causing my dry eye. Put me on steroid drops, which I was on for maybe like a couple of years. Eventually I stopped that because I was concerned about doing them long term, although the pressure in my eyes was not affected at all while I was on the drops, and it was a very low dose. And some other things that I started doing was I was using moisture drops. I found these drops, Fresh Kote, which are now over the counter, but I still get them as a prescription because it's cheaper that way. And I was using this has a preservative in it, by the way, the Fresh Kote. And I was using these. I would use the Fresh Kote maybe at night and in the morning, and then I would use the preservative-free ones. These are ones which I recently got at Walmart. They're just a generic brand, and they actually irritate me less than some of the other ones too. I use those as needed. I started using motorcycle goggles, which I don't have them to show you, but I found some which fit my face perfectly. I have a very small face, so it's kind of hard, and they have these foam coatings around the interior which go right up against your eyes, so it helps block all the wind and the dust. Started sleeping with the Vicks Vaporizer at night. That helped tremendously too. And I started using Tranquil Eyes. I went to a dry eye website. I forgot the name of it now, but a very good website. People helped me out there. And I was told about Tranquil Eyes. These are these little flexible goggles that you wear at night. They have little foam pads which come out, and you can wash them. Wash them every night, put some water on them, and then you put your moisture drop in at night, and you wear these while you sleep, and they keep your eyes more moist. Help if you have a problem with opening your eyelid while you sleep. You know, it will stop that because it kind of gently presses your eyelid. So as I was going to multiple doctors, I mean, I went to probably like over a 6 to 8 year period, I went to 15 to 20 doctors towards the end with obvious signs of diabetes, and I still was never tested for diabetes, and I still ended up almost dead in the hospital in DKA with serious complications, blood clots, and various other things. My vision went totally blurry, but I survived it all, and when I was put on insulin, a lot of my symptoms improved. It didn't go away totally, but the dry eye got a lot better. The yeast infections went away. I still have other issues going on though, which are caused probably now by Hashimoto's. I have Hashimoto's antibodies, so I'm having thyroid issues now, which makes the diabetes a lot harder to manage. I'm going to start trying Synthroid for that probably next week at some point and see if that helps me. And it's really a struggle, you know, when you're dealing with a chronic illness or several chronic illnesses, as I am, you know, and you're going to all these doctors and you start to feel like you're crazy. You know, some of them, you can't even believe the way they speak to you. I'll probably do a whole nother video about that, because I just went to an eye doctor who was very sexist this past week for dry eye. And you just start to feel like you're crazy and you almost give up. But do not give up, because if you're having that many symptoms, something is wrong with you. You know, you don't want to end up almost dead in the hospital the way I did. So about a month ago, I went to a new eye doctor to get a prescription for prescription glasses, because I had been using reading glasses. My vision never went back to what it was after my hospitalization in DKA. It went totally blurry when I was put on insulin, and I had before that 20/20 vision my whole life, and then it went to much worse. I don't remember even what it is anymore, but gradually it improved over a 4-month period. I was wearing several prescription glasses, reading glasses, and I eventually just went back to the reading glasses because they seemed to work better for me, and they were much lighter weight. I tend to get headaches and stuff, and recently I got this pair. This is the progressive pair. I have 2 other just for close, mid-range, and then another for distance vision, because I have to wear them when I drive now. And even these are very lightweight titanium frame. They put pressure with the nose pads. I'm very sensitive and I get headaches and stuff like that. So the reading glasses, even now at night, I have a very lightweight pair of 3 reading glasses that sometimes I'll use to read because they just feel more comfortable to me. But I went back to this doctor and he said there were abrasions in my eyes and he wanted me to start using drops a few times a day. So I started doing that. I was kind of alarmed, and I know I had been kind of lax. I was waking up at night, even with the Tranquil Eyes, the drops and everything. I was waking up at night and my eyeballs were like totally dried out and just so horrible. And, you know, I would just kind of like maybe put a little water pad on it, if anything, and just go back to sleep. So I started using more drops, and in addition to these, several times a day, I also started using Simialsan drops, which one of the eye doctors said is okay. This is the aging eye. This is the complete eye relief. This one has belladonna in it, but it's a very little amount, so you don't have to worry about it. Now, these actually kind of make me feel a little irritated, which happens to me with eye drops for some reason. But afterwards, they help a lot, and then I seem to get a little bit of tearing and more mucus production. And then I recently discovered this one. This is the best one that I have used so far. Hyco San Extra. It has sodium hyaluronic. I have trouble pronouncing this word. It has hyaluronic acid in it and 0.2%. I think there are a few other eye drops that you can get. I had to order this on Amazon from England. So you can't get it in the United States, but this is the best thing I have ever used. I don't know why it works so much better than all of the other ingredients. I don't feel irritated by it, and it does make my vision a little blurry for a while, so just keep that in mind. You know, you don't want to use it right before you're going to drive or read or something like that. And when you use it, you have to only use this drop, and then if you're going to try some other drops, wait at least half an hour in between using this and using anything else. Because sometimes if I feel still a little irritated and dry, I will add one of these in after, or even one of the prescription-free moisture drop. Another thing I've tried doing now, I read someone's idea online, or various people's treatments that they used for themselves. When I'm taking a shower now, I make sure the water is very hot and actually let the shower spray run right into my eyes, and I'll kind of massage it a little bit. Another thing I do, have been done for years since it all started, I use Ocusoft Extra Strength eye foam. Now, I don't have that here to show you because I keep it in the shower and I forgot to bring it here, but that really works. I wash my eyes every morning when I shower, or afternoon whenever I get up, because I'm nocturnal. And I started doing that like twice a day now, and also taking a little tissue and just gently rubbing the eyelids where all of your tears come out. Do a little gentle massage of the meibomian gland. And another thing, which someone said actually cured their dry eye, was that they used wet ones wipes on their eyes. I'm not going to do that because I'm too sensitive. I know that will just irritate me to no end. And they stood under the shower with the spray, forceful spray, with water as hot as they could stand, and just let it run over them. Now, I don't do it like the really forceful one that I have on my shower because I don't want to like damage my eye tissue, but I let it run, you know, with a medium amount, and I think it's helping. I mean, I've only done that for like 2 days now, but it seems to be helping a little bit. One of the symptoms you have when you have dry eye is that you wake up in the morning and you have like crusting all over your eyelids, so you know if you're getting that. I used to think that it was just from the drops, but I really think it's because you're getting clogged up in the little pores where your eyelashes are, or where your tears and your oil production all comes out of there in your eyes. So when I went to this new dry eye doctor, who was really just an idiot, I don't know what else to say. I'll probably do a whole nother video about what he said to me. My tears were tested. They only were able to test one of my eyes, though. Shows how incompetent they were for the salt level. My sodium level was low, which is not normal when you have dry eye. Usually it's high. And they did another thing where they put a strip in my eye and it was stinging so much I pulled it out. I don't know what that test was. I have to call them up and tell them, please give me the results of everything. Because I was quite upset when I left there due to his maltreatment of me. But I intend to find out what that other test was and why, you know, they were not able to like redo it on me or maybe put a drop in my eye into it or something. But anyway, another thing they tested me for there, which my dry eye doctor in the city, who right before I went in the hospital in the ICU, he gave me maybe like 2 to 3 weeks before I went to see him. My mouth was all dried out. My eyes were so much worse. I had sores in my mouth. And he tested me he gave me a prescription to get tested for Sjorgen's syndrome, which I never did because then I ended up in the hospital with all these, you know, life-threatening things going on. So, this new doctor that I went to, they did a finger stick test for Sjorgen's syndrome, so I'm going to wait and see what happens with that. And, you know, hopefully my insurance will cover it and everything, because there seemed to be some question about that. I had to sign some paper, but, you know, I'm going to wait, and then I'm going to make a complaint about the way that idiot spoke to me. So, these are the things that I've been doing, and I feel like the thing that has helped me the most, I mean, you never know for sure, like, when you start to feel a little bit better, but I think the thing that really helped me the most was the hot water in the shower, not putting a compress on, because when I do it with a compress, I get these big, like, little hard bumps in my eyes, and they take a while to go away. But doing the shower with the wash, the Ocusoft wash, and Hyco San Extra, this seems to be the thing that helped me most. I just started using these, like, maybe 2 days ago, and I've used them a few times, you know, in that time period, and I feel a lot better. I'm just hoping it's going to continue that way. Well, today it's a humid day and I haven't gone outside yet, so planning to go for a walk in a while. And even though it's dark now, I'm going to have to wear my motorcycle clothes. Let's see. Hopefully I don't bump into anything. Another thing I do is I take flaxseed oil supplements and fish oil supplements, and that will help too if you're very dried out. So I'm curious to see, you know, when I start taking Synthroid and get the test result back for the Sjorgen's test, if I have that. I don't really know what they're going to do about that, you know, what the treatment is. I'll probably have to go to a rheumatologist, which I've been resisting for a long time now. But we'll see what happens. I'm curious to see what happens when I start taking Synthroid, if that will actually help me, you know, if my eye symptoms will get better and some of my other symptoms that I'm having, if my cholesterol will go down because that's been going up, and I don't feel safe taking a statin. I tried taking a statin in June, and I could only get through like a week or so of it. I was in terrible pain. Every day my pain was getting worse. I felt very dopey from it too, and I had to stop it because I was taking an anti-inflammatory painkiller every day, and I was like, I'm not going to live my life this way. So, I hope you're doing okay with your dry eye, if you have that. Hopefully you don't have it, because it's really awful. But try Hyco San Extra. And no, I don't work for the company. I'm telling you my own personal experience and what helps me. And my next video, next 2 videos, I'll probably talk about how to deal with some of the idiots that you have to deal with when you have chronic illnesses and you're trying to get diagnosed and get the proper treatment. And I'll talk about my new glasses. I got some new progressives and 2 other pairs for distance and mid-range. So take care, everybody. Hope you're having a really nice Saturday evening, and I hope I look beautiful in this video. Bye.